First couple of videos, we went over the short leg posterior splint. The setup is the same. Take the measurement, basically half arm all the way to mid hand, maybe like 7-8 inches, 12 inches or whatnot. I did want to mention something really quick. With the first video, when we splinted the foot, make sure the sock is removed, okay? That's really important. Now with the hand, again, the vast majority of injuries are usually ankles and wrists. And so what we're gonna do here is, yes, if there's a watch, obviously remove it, take the right measurements, make sure the stocking is about 4 to 5, 6 inches extra on each side, so add up another 10 to 12 inches. Now what you're gonna do is you're gonna go ahead and fit this over the arm. Now this is a little extra long because we used it earlier on the leg. It doesn't need to be this long, but usually like about this length. Have it a few inches past the fingers. But what I recommend you do is, what you should do, because obviously you want the thumb to be out. At the base of the thumb, pull this up, and please be careful, don't cut the patient. Just do a little snip, okay? And then what you can do is pull this and have their thumb out like this, okay? Now, what you're gonna do is the splinting material, this is a little long because again, we use it on the foot, but we're gonna use it on the hand here, and it's usually a little bit shorter. Usually it's gonna be mid-hand right here to roughly mid-forearm. So I will cut it just so we can man, it's getting really hard. Okay, you're gonna put it in here. Now before you do that, we have to use that cotton. What you're gonna do is you're gonna wrap the cotton, and again, we're using the cotton, we're just trying not to waste any. But go ahead and wrap the patient's hand all the way with the roll going all the way down. And once you get to the injured area, and usually it's the wrist area, what you do want to do is kind of do a few extra wraps around that wrist. Go up to the hand, come around the thumb, and again go back over the wrist. Back over the hand, back over the wrist. And you do want to cover the rest of the hand because that splinting material is going to be all the way up into the palm area, okay? Now again, if there's a lot of extra cotton here, you don't have to use all of it. Just come around, and if you feel like you got enough, there's good padding, you have good coverage, go ahead and grab your shears, cut it, and you should be good to go, okay? Again, the hand should be like this. Get the splinting material, put it in the palm. And again, on an adult, usually you use a 3-inch, it's a little bit wider, but you put that in there just like that. Go ahead and fold the top part over, okay? You get your ace bandage. Go ahead and wrap it, wrap it, wrap it. Go ahead and go in over the thumb area. And now, can you put your finger right here for me? You can always ask the patient to help real quick. Fold this down. Now this is a little long, again, we used it earlier, but it would be a little shorter. Just expose the fingers and just keep going, okay? If you need another ace bandage, by all means, go for it. And a couple things to keep in mind, please. First of all, this hand needs to be in a slight flexion out like this. I know it might hurt the patient, but you want this to harden with a slight angle, okay? So you want to keep it just like that, and that's really important. Further instructions are going to be given by the provider, but one thing I want you to always be mindful of is the hands, the fingers, and the toes. Always check, make sure they're not getting blue, make sure they're not cold, and don't ever tell a patient you're all set, you can go. The provider must come in and check on the splint and make sure it's in the right position and it's done correctly, and that they basically have circulation in their extremities and their toes and their fingers. Okay, good, looks great, beautiful.